Welcome to Lifeline TV. I'm Kate Callahan. Every minute counts. It's true whether you're having a heart attack or stroke, and it's a lesson that applies to both young and old. You're about to hear how the fast action of doctors at Salinas Valley Memorial Healthcare System's Certified Stroke Center restored Justin Larsen's quality of life. Justin Larsen has always enjoyed working on his swing at Del Monte Golf Course. But these days, he appreciates it even more.
I never thought it would be me.
At just 43, Justin suffered a stroke.
I was at home, working in my office at home, and I was on the phone, and I started talking, and I couldn't understand what I was saying. So I hung up the phone, then I went in and looked in the mirror, and the right side of my face wasn't moving, and my right fingers were tingling.
He immediately went to the emergency room at Salinas Valley Memorial Hospital, where his wife happens to be a nurse.
That morning I was at the hospital, I was going to clock in, and I got a phone call from him. I knew it was him, but when I answered it, I could not understand him. His speech was garbled.
She knew time was of the essence, and her husband was coming to a stroke-certified hospital, Salinas Valley Memorial.
Neurologist came in, diagnosed it as a stroke. Then I went to get an MRI to figure out where the stroke was, the clot. Then I came back and Dr. Alexander said, we need to do TPA.
TPA stands for Tissue Plasminogen Activator.
It's a clot buster, and it prevents the formation and aggregation of fibrin within clots, which allows the clot to organize and become fixed and perhaps grow and have platelets stick to it and grow some more. So it can break up that whole cascade of events that would tend to enlarge clots, and it might dissipate a clot if you catch it early enough.
In Justin's case, it did just that.
Everything resolved. The speech deficit, the facial and tongue weakness, the right arm weakness completely resolved within a short time after his receiving the TPA intravenously.
Everything came back, and I was out of there in about 3 days.
The hospital stay may have been short, but the experience has had a lasting impact.
More active, more health conscious. Yeah, it's changed dramatically.
Justin lost 20 pounds and finally quit smoking.
And I'm sorry that this is the way he had to eventually find out that he needed to quit smoking, but that was the last cigarette that day.
All things that are recognized risk factors for stroke.
All of them could be modified. He was overweight, and he smoked a pack a day of cigarettes for over 20 years, and he was a bit hypertensive.
Justin is changing his ways now and hopes others will make lifestyle changes before it's too late.
I thank God every day that I can even get out of bed and go just be normal. Most people look at me like, you had a stroke? Luckily, Dr. Alexander, he saved me.